So today I will share some experience of the operating. So as some doctors have asked me about how to measure the using our machine, the FT machines to for those obese patients, because usually it takes a long time to measure the obese patients because we can't find the good position of the liver for obese patients. So as we share on the screen, for normal body size, we usually find the liver position as we touch the xiphoid with our fingers and then move to the right downwards and to the middiastry line. And then you can find the liver between the 7th to the 9th intercostal space, just near the middiastry line. That is for the normal body size. And for those patients who have the narrow intercostal space, we usually let them to make the left C shape. Left C shape means we let the patient to put their right hand below their head and then bend their right arm to the left and put their right leg on the left leg. That is to expand their intercostal space. And so for the position of the liver for those thin patients, as we can see in the picture, for the patients, we usually find the position near the middiastry line. But for those thin patients, and the position we choose, we can find the lower intercostal space, and which the position is above but close to the middiastry line. It means the position we choose is between the anterior axillary line and the middiastry line, but it's still near the middiastry line. That is for the thin patients. And we can see the picture here, the first picture and second picture. That is the correct way we hold the probe, and that is to measure the thin patients. And for obese patients, so where is the position of obese patients? As we know that the obese patients, they have the thicker fat layers. So their liver is located at the higher intercostal space compared to the normal body size patients or the thin patients. So we suggest that we can try the upper intercostal space on or below the middiastry line. That means the position of the liver position of the obese patients, it could be between on the middiastry line or between the middiastry line and the posterior axillary line. So that is a big difference because we measure different patients with different body size. We choose the different areas. That will be very helpful for us to find the good position of obese patients and get the good results using the FT machines. And so how could we judge if the measurements results are successful when we use FT machines? So we don't judge the results, which is we get high results or we get the low results. We judge the results following our principles. So as we know that the FT machines, it has features which has the probe could distinguish the subcutaneous tissue with the liver tissue. That means we can measure the normal body size patients. We can also measure the obese patients. Why? Because from the scanning interface, as we can see the picture in the middle, for the M mode, the first picture on top, we can see the subcutaneous tissue clearly. And below the subcutaneous tissue, we can see the steady layers with the gray color. Those are liver tissues. So no matter it is the thin patients or it is obese patients, we just distinguish the two parts and we just locate on the liver tissue. We just measure the liver part. So that's why we need some criteria. So when we do the measurements, we need to see the liver tissue and then do the measurements. So the liver tissue is shown like that. It shows the steady layers of the M mode, and we can see there's no big difference of the brightness of the I mode. And for the A mode, in the middle, we can see there is a very straight line, because if it shows like that, you will know that the signal just goes through the liver very well. So it means we get the liver just gets the signal. And then for the E mode, we can see it shows the regular straps pattern. It means the propagation path of the wave, the signal we use, it works well. So we need to follow the 5 criterions, and we can see the liver, and we do the measurements. That then we will get a good results. And how could we judge those parameters? We will get the liver stiffness and the UAP results. So we can see that we have 3 conditions. The first condition is that we get at least 10 valid measurements. Why? Because we need the 10 valid measurements, because all the results we get is the median results. The median result means it's not average results. It's the median result means we queue all the results from the smallest to the largest, and we choose the results in the middle. So it will just remove those very large results and very small results. So we need 10 valid measurements results, and then we get the median results. So that would be accurate. And the success rates, we will control it above 60%. And the IQR on median is another parameter which will help us to control the deviation degree of all the results. So for example, if I measure these patients, the result we get should have a very similar results. There should not have a very large range. So we use the IQR on median parameter to control the deviation degree of all the results. So if we follow the 5 principles we have, and we can our results could satisfy the 3 conditions. So we have the confidence to say that the result we get is accurate. It's very good results. And yeah, that's for some important key to operate the active machines. And if you have any other questions about operating, you can also ask questions.
Thank you, Chen. So yeah, so that is good. So they are the difficult patients,
Yes.
obese, because
Yes.
it is difficult to find the intercostal space, and then
Yes.
as you said, probably we need to go a little bit higher up. And
Yep.
so is there any difficulty anybody has you have noted with cirrhotic patients? Patient is obviously cirrhotic, but sometimes I don't get proper values in cirrhotics.
Yep.
Is it like the liver gets shrunken? Does it move far away from the the rib cage? Sometimes I don't get proper values if the patient is obviously cirrhotic with a real shrunken liver times.
Thank you, Chen Chen. I have a picture to show about the obese patient in one of our in one of the Malaysia hospital. This is the picture. This is the obese patient in Malaysia. Also is using our iLivTouch machine to diagnosis. Of course, it's very difficult to find the position of these patients where the liver is. However, after finding, we get the result is, so for the stiffness is 3.9. There's no fibrosis, but the UAP is very high. It's 342. So, Chen Chen, you can see how is the report of this?
Yes, it's from. I can see that it could satisfy the 3 conditions we have. We can see the fat layers is very thick, and we can also see the liver parts. We can see the steady layers, and the brightness is also good, and we can have the A mode picture, and the E mode picture is also clear. Yeah, so that is a very good result. Very good operating. Yeah.
Okay, thank you. So actually, for the obese patient, we are able to diagnose it, but it's really need some techniques, and it's very difficult to find the location of the liver. This is the major issue. So it's really need some techniques. But if you have any issue about the operation for the obese patient or have like that, you can also contact us. We can also discuss and to guide you.